Good day and welcome to Mental Health and You. I'm your host, Cynthia Timms, and thank you so much for being part of this great experiment in mental wellness, particularly in communities of color where it's so needed. Mental Health and You appear in the pandemic. Let me say that again. Peer in the pandemic, more specifically, peer support in the pandemic. My goodness, in these times of uncertainty and you just don't know what. My guest today has been the a fine example of peer support, a fine example of peers taking it to the street, upping their game, so to speak. And he's going to talk about what he's doing. He's going to talk about some new projects. I want to welcome Samuel Cabassa, peer advocate in New York City. Samuel is a peer support of many years, peer support advocate of many years, I should say. Uh, a man who has a long history, a varied history, but he's bringing all of those experiences, all of those trainings to his new project, which is going to do wonders for our community, not only in the Bronx, but beyond. So I want to welcome Samuel to Mental Health and You. And thank you so much. Thank you so much, Samuel.
You're welcome, Cynthia, and I'm very appreciative of this opportunity. And I want to say hello to everybody out there tuning in. I guess I'll start with a little bit of demographics about myself.
Yes.
I'm 63. I'm 62 years old. I'll be 63 next month. I was born and raised in Manhattan, in 105th between Columbus and Manhattan Avenue, in a community that was rife with blight. As far as the infrastructure, it was very heavily affected by drug trafficking, violence, gambling, a very dysfunctional community that was affected very severely by alcohol use disorder. Back then it was called alcoholism. We realize now that it's a brain disease, so we try and get away from the label of alcoholism and use the proper term, which is alcohol use disorder. My father was affected very severely by alcohol use disorder. I succumbed to the temptations of drug trafficking. I used drugs, marijuana, alcohol, and cocaine intranasally. And getting caught up in making bad decisions, I wound up going to prison from 1977 to 1981.
Wait, Samuel, you're in prison for how many years is that total?
Well, my first stint was from 1977 to 1981. And then I came home, and due to circumstances and a lack of preparation and being still relatively young, I was arrested again in 1982, December 16th, 1982. I was in my vehicle with two friends, and we were accosted by a yellow taxi cab, which happened to be at the time that I found out was in court, a yellow taxi cab that had three plainclothes police officers known as the Street Crime Unit, similar to the unit that was disbanded recently here called the Anti-Crime Unit. So for no reason, I committed no crime. There was no suspicious activity. I was just in a Cadillac, and I had two friends that were dark-skinned Hispanics, a pass for African American, and we were racially profiled, and I was pinned in a desolate area on 158th Street on my way to enter that West Side Highway. And guns were trained on me, and I took off, and they started firing, and I got shot in the back of the head. And the chase ensued all the way to 125th Street. They set up a roadblock. I attempted to stop. The roadblock started shooting at me. I kept going. But this is a story for another day. I wound up getting convicted of 4 attempted murders on 4 police officers. I wound up with 38 years and a third to life. 10 years later, in 1992, I received a full reversal from the New York State Court of Appeals. And I was given a very ridiculous offer as far as the cop out, 20 to 40 years. At the time, I had 10 years in. I was still claiming my innocence. And I went back to trial, and I wound up winning acquittal on the 3 attempted murders on the 3 plainclothes officers in the taxi cab, found guilty of attempted assault. And I was found guilty of attempted murder on a police officer in uniform at the roadblock that was never shot at. And I wound up with 30 years to life. I wound up serving 34 years and 25 days consecutively. And I was released on January 10th, 2017.
Did you know anything, Sam, I want to ask you, did you know anything about peer support when you was released from prison? What did you know about, if anything, about peer support? And as a way of, getting you back into society, did you know about the Fortune Society, the Osborne Society, any type of society that would help you reclaim your life, so to speak?
Yeah, I was familiar with Osborne and the Fortune Society. When I was in prison, I worked in the pre-release center, which many decades later was retitled the Transitional Services. And we used to help individuals that were going to the parole board prepare their package of letters of recommendations. We would write to the Fortune Society, to Osborne, and other organizations to get reasonable assurance letters to put in their parole folder. We would conduct mock parole hearings to prepare individuals, because you get nervous, you don't know what to say. So in that capacity, I had prior experience. I also, on my longer term of imprisonment, was involved with Sullivan Community College, taking an alcohol and drug abuse counseling associate's degree. I was 15 credits short of completing it because I was placed in the special housing unit. But in that course, there was field experience required, field experience 1 and 2. Since we within the confines of the facility, the students couldn't do that. So they devised a substitute, which was we were supervised by a gentleman named Pat O'Keefe, who was the Alcohol Anonymous and I believe Narcotics Anonymous supervisor and civilian that came into the facility. So he assigned us a caseload of like 12 inmates who would be selected according to toxicology reports, where like in the facility, if they tested you for drugs and you came out positive, then you was put in that group. And so I did peer counseling on that level with a great deal of success from the feedback that a lot of the inmates that I worked with gave me, and the reports and my grades in college. So upon reintegrating into society, I went to Bellevue. Well, they call it Bellevue Men's Shelter, but it's really not. It's the 30th Street Men's Shelter in Lower Manhattan, but it's located in the building that used to be the Bellevue Psychiatric Center. And so it's often confused as the Bellevue Shelter, but it's not really the Bellevue Shelter. I spent one night in there, and then
and what was that about? Tell us, what was that? I mean, how was one night, even one night?
Yeah, it was a very traumatic experience, because after being incarcerated for 34 years and 25 days, and I, earned my freedom, when I step out, I go into another institutional setting, and it's with individuals that are suffering, from substance use disorder, mental health disorder, co-occurring disorders, which is substance use and mental health combined. Individuals that are really, going through the toughest times of their life. And here it is, I was trying to regain, you know, a new life, and I'm put in an environment that was similar to the one that I just came out of. And the following day, I was instructed to go to Ward's Island to the Schwartz facility assessment shelter for men. And I spent another night there. And that was even more traumatic because there was drug activity going on. It wasn't conducive for someone who has a prior history of alcohol and substance use, and came out of, a restricted, a controlled environment, to come and be confronted with the same thing that you left behind when you went in. And so on the second day when I came out, I went to my parole officer for the first time. I gave her my sister-in-law's address. She approved for me to stay there. And I, relocated to my sister-in-law. So basically, I was staying with my sister-in-law for 2 weeks, then another sister-in-law for another like 4 weeks. Then I got myself a room. I rented a room like similar to an SRO, but it wasn't associated with any kind of program.
And who helped you? I mean, you've never had to rent a room before. Who helped you? Did you have a case manager, a social worker, a peer specialist? Who helped you rent a room? Who helped you with this life skill?
Yeah, I had to go to HRA and seek, benefits. I was given SNAP benefits, $194 for food. I was given a whopping $15 emergency cash assistance upon coming home.
Wow.
Yeah, it was huge. And so it took about a month and a half before they started giving me $90 biweekly as cash assistance. And my daughter, I have a daughter who'll be 44 next month. I have 4 beautiful grandchildren, ages 24 and 22, young women. A grandson is 19, and one that I consider my grandson. He's my daughter's foster child, the grandson of one of my sister-in-laws that I stood with. And I believe he just turned 4. So my daughter and her husband helped me to gather the money to rent the room. The rent was $600 a month, $650 a month plus $40 for air conditioning. And I'd use the $90, it would turn out to $180 bi-weekly, 90 and 90, total of $180 per month. I would use that to supplement, the rest of the rent. And basically, I really, was on a shoestring budget. And when I went to HRA, because I had a history of alcohol and substance use disorder, I was told that I had to see their CASAC, a credentialed alcohol substance abuse counselor. And I met a gentleman named Khalif Hassan, who directed me into going for a CASAC credential. And he explained to me that I can go to Access VR, which is a state program. It's a wonderful program that really helps people who want to get their life back together and want to acquire either enhanced education or vocational training. And it's for people that have disabilities. My disability was alcohol use disorder. I also suffered from arthritis, conditions, but they provide Access VR as, I believe, adult continuing career education and vocational rehabilitation. So I went through the orientation process, and they gave me a voucher, and I went to Hostos Community College on 149th Street in Grand Concourse. And I started studying for CASAC, taking courses. And in the interim, I met someone from an organization called Bridge Back to Life, who I had known for many decades. And he directed me into the peer recovery, the certified recovery peer advocate. And so I took the training and I got my certification, and Bridge Back to Life hired me, I believe around March of 2018.
Okay.
And I worked as a certified recovery peer advocate, and I was assigned to work in Wyckoff Hospital. There was the first time that they implemented the program in that hospital. I and another co-worker opened up there, and it was an extraordinary, wonderful experience. Using my lived experience to help
Yes.
other individuals that are suffering from similar problems with alcohol and substance use and mental health.
Samuel, this is 2018.
Right.
You're working peer now.
Right.
After all of these life experiences in prison, after prison, your drama with HRA and Ward's Island, you're now a working peer.
Yes.
Due to your live experiences and your training, you say you're working at Wyckoff Hospital now.
Right.
At that time,
Right.
I mean that's amazing considering the breadth of what you went through, the gravity of what you went through. For you to still be here in the midst of us and be able to share. I want to think. I'm listening to this, and I'm just stunningly amazed. Because you are the epitome. That's the word I was looking for. You are the epitome of peer support. We call this. I call this episode peer support in the pandemic, but you're peer support for all the ages, as far as I'm concerned. You're a peer support for the ages, and you're an inspiration to so many others. But, this is 2018. You at Wyckoff, and then you go into another hospital after that.
Right.
And, in this time that we have left, you decide to take it even up a notch, even more, by being a peer in the street, taking your training, your lived experiences. And I wanted to get to that because I think that's so, so, so inspiring. What you've done thus far is inspiring, but my goodness, you're taking it up a notch even more.
Well,
so you. Now, tell us about this, what you call this, well, when I was reading your biography, this nonprofit that you want to start to take this work to the street, peer support to the street. You want to start a mobile crisis unit, I was reading.
Mobile hygiene.
And yes, mental hygiene. Tell us about that. After all of this, tell us about this mental hygiene crisis unit.
No,
we're going to go back to that other stuff, but yes, because I want to talk.
All right, thank you. Just very quickly, I want to say that my success wouldn't have come to fruition if it wasn't for the help of Access VR,
yes.
Oasis. Oasis and Access VR had put programs in place that people that really want to change their life and make a transition, they have made it possible. So without the help of Oasis allowing me to get certified and allowing me to work in the hospital, we wouldn't be having this conversation. But I also became a
also worked by, it's okay, you also worked at, if you want to mention the other hospital that you worked
Bellevue
in.
Hospitals, where I presently
there you
work
go.
In the ER. I'm a certified recovery peer advocate stationed in the ER. I advanced my training. I became a trainer of trainers. I train people to do the job that I do. At Whole Souls Community College for the last 2 years, I've been a co-trainer for recovery coaching and peer ethical considerations of peer ethics. But to answer your question, in doing the work that I've been doing for the past 3 years, in Wyckoff, I was also stationed in the emergency room, but I also worked in the floors with patients. And I noticed that most of the population that we served are the homeless population. And a lot of times, it seems that they come in presenting certain medical issues, and really what they need is a sandwich and a time to sleep because they're tired of sleeping on the sidewalk,
Someone to listen to them. Yes.
Exactly.
Yes.
So, in working in the emergency room, I basically have the maximum 1 hour to engage with them if needed, but we hardly ever do that because we have other patients to see. And so I had been accumulating, a lot of, data in my mind and, from observation, seeing that, you know, they really need more help. And so I I saw that, one thing about Wyckoff and Bellevue, the medical staff, the doctors, the nurses, the patient care assistants. I mean, I've never really seen discrimination just because they come in, unclean, malodorous. I've seen doctors really give so much affection to their patients. And I've
That's
always
it. Wow. I want to sit on that. You say you never saw any discrimination.
not that
That's
I
saying a
never saw,
lot.
not that I never saw discrimination, but if I had to put it on a percentile of 100,
Hmm.
I would say 97% of the time I did not witness it. It was isolated incidents, and there's a lot of different ramifications that evolve around that, but um, I just wanted to do more. So I thought about,
Hmm.
what do they need? They need to be able to reclaim their hygiene.
Hmm.
So thanks to an organization out in California called Lavame X, and it's like a play on word in Spanish. Lavame means cleanse me, clean me, wash me. And it's an
Hmm.
organization that has a mobile hygiene unit. A mobile hygiene unit is like either a bus, which is what they first converted a regular long school bus into
Hmm.
showers. And now, there's all kinds of fancy ones. I have one that I put a 13,000 down payment on out of my own pocket that I'm not getting back because I still don't have my incorporation. I'm in the process of getting incorporated with a 501c3, but I wanted to start this as soon as possible. And if I would have waited, it would not have started to get built till 2021. So it's going to be ready by the middle of November, and I'll have my nonprofit up and running. Um, what I have
And
is,
where is it going to be, Samuel? And where will it be running, by the
well,
way?
I would have to contact the mayor's office and
Okay.
seek their guidance to designate areas because it's going to be a 24-foot trailer, and that
Hmm.
takes up a lot of space. It has 4 private shower stalls. In each shower, you have a sink and mirror, and you'll
Hmm.
be supplied with soap, shampoo, towels, washcloths, shaving equipment if you request it. Um, and you'll be given 20 minutes to do your showering. But before the showering, I'm going to provide barbering services. I'm going to have a chair with a licensed barber to give all of the services are free. We're going to give free haircuts. We're going to serve hot meals. I'm
Hmm.
also a case manager, so
Hmm.
I'll be doing intake and peer counseling on site. um,
Wow.
because of the job that I've done at Bellevue Hospital, I've received so much love and support from the doctors and the nurses and the other staff, the patient care assistants. And when they found out about what I'm going to do, several doctors and nurse practitioners told me that they want to volunteer to do medical health screenings.
Oh,
Um,
that's awesome.
yeah, so I
And
want
what type of screenings?
to.
Medical health screenings, COVID testing? What
Yeah,
type of callings?
we
What
could
type of
do
screening?
COVID testing, body mass index, hypertension, diabetes. Um,
Okay.
the 4 basic ones,
Hmm.
and referrals to physicians. It's not going to be like a full blown clinic, but uh, the homeless population, they do not go to the hospital for regular checkups. They wait till the
Hmm.
conditions are exacerbated, by other comorbidities. And then when they have no other choice, no other recourse, then they go to the hospital and they present with greater health problems than what they would have had they gone through regular medical health screenings and made their medical appointments and complied with their medication. So what my organization plans to do is to reacclimate them to regain their daily hygiene skills by providing access to, you know, these services, and sitting down and talking with them and building a relationship and building trust and using motivational interviewing skills to try and have them reflect, you know, on the benefits of going to their medical appointments, taking their medication.
Well, and how can they find you? Where do you have a website, Samuel?
I haven't put anything up yet because I need to get the certification, which I'm in the process of doing right now. It should take no more than 2.5, 3 weeks. And once I do, I'll be able to put up the website, distribute information. And like I said, I would have to contact the mayor's office, let them know what I'm planning to do so that they could designate an area where I could take the mobile hygiene unit and the medical mobile clinic and park it in certain places for 4 or 5 hours a day. As you know, right now, there's a big problem with housing the homeless in hotels and moving them, you know, like a merry-go-round. People are not comfortable in the community with the homeless population. So I can't just put it anywhere. I need to get, you know, the mayor to tell me it's okay to do it, and this is the area we'll designate for you, and then we can take it from there.
Well, Samuel, we're going to have to start to wrap up. Well, definitely, we're going to have a part 2 of this because we got to learn more about this exciting venture, this necessary venture, your next step in peer support. But so we're going to have a part 2 on this, on mental health in you. And I do appreciate, you know, if it's okay with you, we're going to have your contact information in our closing credits, if that's okay. So if people want to find out more so far where you've come, they'll be able to do that, okay?
Okay.
But as we start to wrap up mental health in you, I want to thank again my guest, Samuel Cabassa, peer advocate, peer innovator, businessman. And I thank you so much for everyone, all of you, to just reaching out again to mental health in you. So necessary, we believe, in this time of uncertainty. So once again, thank you. And for mental health in you, I wish you all the best. I wish you love and happiness, peace, prosperity.